Why settle for incremental growth when you can boost your revenue, cut costs, and adopt new technology more quickly? Why navigate the complexities of AI and the complex tech projects or technology projects alone when you can have insights from the forefront runners and the innovation providers such as Glorium Technologies? What the world's leading AI and technology experts are doing right now to transform healthcare and life science organizations and drive unparalleled growth right now is what we're discussing in these podcasts. This podcast is your gateway to the answers, providing a deep dive into the world of artificial intelligence and its power to amplify your revenue, to cut costs and adopt those efficiencies that are critical to deliver patient care, especially around healthcare and life sciences. So my name is Dudley Peacock, and I'm joined by our AI and technology expert, our resident expert, Dmitriy Stepanov. And welcome to our podcast, The Revenue Amplifier, AI in Action. Hello and welcome again to another episode of The Revenue Amplifier, AI in Action. And Dimitri and I together, we're really looking forward to today. And as we go into the more meaty things of AI in healthcare and life sciences, we're now starting to really dig into some of the anomalies and some of the weird things that can actually happen within AI and how to then mitigate those risks. Because in healthcare, we need to be very specific with the output. And AI is not necessarily built in that way. And we're just going to work around what that actually means. And then we're going to go into a few other elements. But welcome, Dimitri. Dimitri, and yeah, it's good to see you all chirpy and ready. It's bright and early in there where you are right now. So let's rock and roll. We're going into stochastic nature of LLMs.
Hi, Dudley. How are you doing? Yeah, thank you, by the way, for properly pronounce this word, because I was kind of struggling with this stochastic word myself. Well, I mean, after all, English is my second language. One of the fundamental aspects of large language models that it has stochastic paradigm in its core. So what it means that models operate based on probability and randomness. That's basic definition of the stochastic, right? And that allows the model to generate some varied outputs for the same given input. Okay? So it's not like algorithmic or not some like image recognition system. So you have some artifact, and the algorithm will determine that this artifact belongs to this disease or to this disease, or is it just a normal artifact. So with LLMs, it's slightly different, right? And I guess LLMs can produce different responses under sometimes similarly conditions, or actually it can produce different response under the same conditions. And it actually complicates its feasibility, its reliability, its a usage, okay? And obviously it will lead to some unexpected results, and sometimes it's very beneficial in generating some creative solutions or insights or summary, right? But it poses risks when it applied to critical domains like healthcare, and where obviously accuracy and predictability is a major paramount, I would say, to some extent.
Yeah, we in the last episode we spoke about that AI is not really creative, but what it does do, it creates a variable answers. So If you take a calculator, you say 1 + 1 is 2, and no matter how many times you do that calculation, it's always going to be that same answer. The beauty, but also the risk in AI is that you can ask it the same question, and it will come up with roughly the same answer, but it could be varied in the way that it answers, and it could even come up with potentially different answers, but in the same fashion, or even come up with answers that are not necessarily relevant to the question. So it's quite interesting, the stochastic nature of LLMs and its impact. It means that you could probably get more creative answers, but they are not that reliable as you mentioned. An algorithm, the answer will come out exactly the same every single time you run the calculation. So that's the danger.
Dudley, let's twist this actually conversation from the danger. That's actually very interesting. You use this word, and that reminded me one case from my long conversation. It was, I don't know, like 20 years ago or so, maybe 15. I don't remember exactly the date. So I was talking to my mentor, and that's actually, I'm very grateful for all the efforts he put in me. So basically, I was talking to my mentor, and during one of the conversation, I was talking to him about my son, okay? And my son has one specific character, I would say, right? And I was not very happy about the specific side of the character. And when I talked to him, he said, well, you cannot change it because that's what he is. But you can always put it in advantage, any character, basically. And that's actually gave me a totally different perspective on the life, obviously on my relationship with my kids, with everybody. And here I keep applying this rule actually pretty much, trying to apply this rule pretty much anyway. So here it is the same. So it is stochastic paradigm, it is stochastic approach. So just use it, all its benefits, use it because, creating summaries, creating some additional creative outputs, that's all beneficial. We're all using ChatGPT, Gemini for our, not daily work, but very frequently, right? So this problem, which is stochastic paradigm of the LLMs, we're using in our advantage. So let's depart from the word problem. Let's use the word character, property.
I love that analogy because I think that sums it up so beautifully, because the inherent nature, character of the LLM and its output is variable. So let's use it where it's strong, and let's not
and be aware of its weaknesses. So, if you think that this is a weakness in your application, just be aware of it and just go work around of this weakness, if it's a case, right?
Yeah, I love that, and this leads into our next part, which is the paradox of self-referential loops.
Yeah.
And so again, it comes now back to that character we're talking about. Go for it. Tell us a bit more about that, because that in itself, stochastic, big words we're using, and paradox of self-referential loops. Those are big words for the everyday person. So we must maybe be a little bit more.
Yeah. So let's simplify. So it's basically learning from itself, all large language models, they. We see that it's actually, they gain traction in healthcare, and they create white papers, they create education content, they create summarizing some clinical text and identifying risks. And as it generates all this content, we are basically running into the situation, I don't want to use the word problem here, when LLMs start learning on their own generated content. Okay, so basically, this issue arises when AI generated content. It mimics human writing, and it, at some point, AI stops recognizing that it's actually AI generated stuff, and it uses it for its own learning content. Okay, and it can result in so-called echo chamber, basically, where it becomes very difficult to differentiate between original human insight and those generated by artificial intelligence. And basically, and if you go through the several cycles, it dilutes, I guess, content. So we use a lot.
And I suppose it's compound as well. It's a compound effect because
yes, compound effect. Yes. So if in originally generated content generated by AI, there was some bias. So the second loop of reusing this content will only increase this bias, and it will create more, bigger bias, I guess. Very simple concept. I mean, there is nothing, and again, that needs to be, everybody should be aware about this. Obviously, be more careful with selecting content to train your models, and actually, I think very soon we will have a very good, I guess, regulation in this area, because there are a lot of conversations related to marking artificially generated content with some kind of stamp that it is actually AI generated. So, and I think it should be law. Frankly, I would support this regulation, even so it might damage some copyrights. It will complicate our life, because now we need to say, well, if I generated using LLM and used in my, I don't know, some marketing material or in some white paper analysis, you will need to refer to LLM. But again, it will create those borders where you will not be able to penetrate and get into this self-referential loop, basically. So again, it's not a problem. It just think that we need to be aware, and I don't see benefits of this character as of now. But again, I don't know everything, so or maybe people didn't come up.
Well, there's a bit of a light at the end of the tunnel, because I think if you look at the growth and the changes within AI and especially generative AI,
right.
Predictive AI, I suppose, is slightly different in the way that it creates content and so on. But I think it today will be the worst it's ever going to be. It's not going to stay the way it is today. It's incrementally getting better and better and better and better. So it's not like it's forever going to be like this. I have seen a graph where the graph is actually that sort of steep curve in terms of human beings tend to think in straight lines. We think today and then incrementally improve. So when you do a cash flow forecast,
right,
you say 10% increase in revenue for the next 5 years. Then you go 10%, 10%. That's what we think the way AI is going to improve. In fact, it's not that. It's going to compound its improvements to the point where almost as if it's not AI generated, one has to question whether the human behind the creation was in fact qualified, certified, has got the capability to understand and detect the same quality as the AI. There's going to come a time when there's going to be a crossover. My guess, it may or may not happen, but that's my guess right now. I think things will just get better.
No, I mean, and actually, if you look at the history, that's pretty much, and actually the good analogy, I think that's a good analogy to AI, what we witness right now. It's basically Wild West with Golden Rush. So it's a lot of unknowns, a lot of dangers that needs to be taken into the consideration, but opportunities are huge. So that's I think that's where artificial intelligence stands right now.
Yeah, and if you think about the gold rush and all these big rushes where there was lots of colonization and movement of people
right.
for digging up things, eventually those industries died down.
Yeah,
and there were a whole lot of new industries that built up on top of that. And if you think about the evolution of any economy, it started at a particular place and is in a completely different place right now. So it's going to be roughly the same thing. So I'm guessing that there's going to be quite a compound improvement. I'm just thinking about the warnings that you were saying, sort of maybe a stamp somewhere that says this was AI generated. But I go back to to things like, cigarettes. They got those on the cigarette box where they say, beware, don't smoke. It might be bad for your health. Or you watch a movie on TV and it says, age restrictions, and it's going to be, even now, I saw the other day, product placements. Be aware, there are product placements in this movie that I watched. And then there's advertising within the movies we watch these days, and they have to tell you right up front that there's now product placements inside a movie, which is interesting, but it's like, okay. So sometimes the warning is going to be like, who's going to take that seriously? I suppose the more important the output is, the more that will be taken seriously.
Yeah, true, but I guess my argument would be, yes, you can watch, like kids can watch movie with any age restriction if their parent didn't set up properly their TV or whatever system they have in the house, right? So, okay, well, let them watch 16 plus movie because I didn't install. But if parents actually wants to restrict, it gives him some framework to do it. So same as here. Well, you can use the garbage. You can train your model on the LLM content, and at the end you will receive, appropriate results, right? Or you can actually take a look at those stamps and make sure that your input is clean and your data model is clean as well. So I guess people do violate rules. People do go around those rules, but again, it's as long as we have something to follow the rules to improve our environment, that I think is more important. Yes, of course, you cannot enforce people to stop smoking, right? But at least you can say, well, that's your consequences.
It's not good for you.
Yeah. So, it's a free world, at least.
And I think that's the beauty about the fact that we do have AI, which gives people that don't necessarily have access to knowledge and information, models now that could give them at least a 90 or 95, 100%, 99% accuracy, depending on what they're asking the AI to do.
That's actually, yes, and that's what I wanted to say about all those properties, attributes of the LLMs that we have discussed so far. Even so, they look very scary, right? Wow, it's going to be some random results or anything else. Mm-hmm. But again, I believe we did talk about this, but I guess it won't hurt if we will repeat it. But at the end of the day, the results of those LLMs in many cases are better than human generated, because humans do make mistakes, and the probability of the mistakes done by human are actually higher comparing with LLMs. Not everywhere yet, but in many areas. And that's why actually in the healthcare industry, we see a pretty wide adaptation of AI already, even with the current condition, even with the current regulation, even with the current kind of, I don't trust AI generated content. Oh, it's not consistent. Oh, it hallucinates. No, it actually works better. It produces better results at the end of the day. So again, you just need to be aware that those mistakes will happen, and you just control it, damage control, risk control, mitigate control, put your framework around those issues or around those attributes or properties of the models. It definitely shouldn't stop you from using it.
Yeah, I like your analogies. It's the guardrails. It's
yes.
As in provide the framework, understand what the character is of the output, understand how the model works, and I suppose that's why we're trying to do this podcast. At the end of the day, is to make people aware that it may have a certain character, but actually it's not dangerous if you understand what sort of framework it works in. There was an issue some years back, and I'm talking probably easily 10 years or so, where some journalist somewhere got wind of a story of I'm in the UK, so we have the NHS, and there was some story that broke, and I don't know how true it was, that the doctors or the general practitioners, the GPs, were using Google to help them diagnose patients. They were Googling symptoms to try and get an idea or ideas about what could potentially be wrong. And they weren't even using AI at the point. Now, how true that story is, I don't know. But I do know that people do try and self-diagnose themselves on Google as well. I've heard of people having a symptom, and then instead of going to their doctor, they just type in Google, I've got a headache and a stomach ache and a this and that. And like, what could it be? And then obviously it puts out a whole lot of output. We don't know whether those articles are correct or not. And then later on, we had these niche sites that would then, you can then put in symptoms and that would sort of give you an idea. And now we're moving into an AI-generated world. And I'm guessing it's almost in that sort of vein. But doctors and practitioners, in my mind, and this is the point I want to make, they would like help. I think if you're a practitioner, whether you're a lawyer, a doctor, whether you any kind of engineer or whatever it is that you practice in, even a business owner, how do I improve my business? How do I sell to my customers? Even any kind of question. I think AI will make information more accessible and easier to generate, hopefully a much better output than trying to Google and then trying to search many articles and hope you're going to get the right article or not. I don't know what your opinion on that is.
Well, I mean, obviously, that's kind of, that's literally not even the gray area. It's white and black. LLM will help it. What I wanted to add to this, that, you probably also, but for example, myself, I can multiply. I don't think I can multiply hundreds by hundreds, right? But I can easily multiply any numbers from 0 to 100 by numbers from 0 to 100 in my mind. I can push probably to hundreds also. But my point is, like, if you take a look at the current generation, like school generation, they cannot multiply. I mean, 11 by 11, that's, where is my calculator, right? And because they are not trained to do this, they don't need to do it, because a lot of equipment around them, computers, calculators, obviously a long time ago, iPads, tablets, whatever you want, okay? And you can think, well, it's a kind of de-skilling. People are losing some skills that we were proud of, because, wow, we after school, we are so smart, we can do this, we can do that in our mind. And before, hold on, so let me finish it. So, actually with, I guess, with the increased reliance on the large language models, especially in the healthcare industry, tasks like compiling patient histories, analyzing medical data. So there is a concern that professionals might see a decline in their skills because they don't use it, because they will not use it the way how they use it now, okay? And because, I mean, basically the quick solutions that large language models provide, they could lessen the drive for thorough research or deep learning, or potentially weakening practitioners' depth of knowledge and critical thinking, and so on, right? And I think it will happen, because just like with the current generation who don't want to do the calculation in their mind, it just, the whole idea is kind of sounds strange to them. Why? And we need to adapt to this shift, just to avoid any negative outcome in the healthcare. And here's, I mean, we need, well, I mean, first of all, obviously, we need to balance the use of AI with the cultivation of the irreplaceable human abilities, because they are key in the improving patient care. And And we're talking about, I don't know, cultivating human qualities like problem solving, critical thinking, and I guess more importantly, a soft skill, talking to the patients, working with the patients. Let's focus on these areas, and there is a lot of space to improve, to be frank, in this area, and let LLM to do the calculation, just like calculator does in a multiplication, and let's do what we do as humans. So again, that's kind of problem. Technically, you can take a look, but for me, it sounds like it's another opportunity to make a big shift to become more human in the healthcare area. So that's my idea.
Yeah, I just remember, I mean, when I first started in business, we didn't have GPS. I suppose it's ages or dates me now, but we didn't have, you know, your Google Maps and all that type of thing. And we had the A to Z, the map book. We had these big fold-out maps. Yep. And I remember having to, when I'm driving somewhere, get out of my car, put the map on the car itself to try and find out where I am, and then to plot a route. I don't have to do that anymore. I just put in the address and I drive. So does that make me a worse person? I don't think so. I've saved a lot of time.
Yeah.
And I'm getting there more accurately. And the actual map programs, if you like, are avoiding road closures, traffic accidents, all that type of thing. So it's making me more efficient. It's not dumbing me down. It's just giving me more time to do the things that I want to be doing. So, and I'm thinking that's probably where it starts to balance out. Because we started the podcast today with, there's a particular character. And I absolutely love your analogy about your son having a particular, or your child having a particular character. So, and how do you adapt and address that to have an understanding and to work around that. And then on the flip side is, I'm actually seeing positive things coming out of this. And for healthcare and for people that have to see multiple people on a daily basis, I love that thing about soft skills. Let's get back to human beings. Let's get back to having a good bedside manner. I think they talk about some doctors have it, some doctors don't, for instance, or practitioners. And it's about understanding more from an emotional and soft skills level, where you can let the crunch work, a calculator work now, which will be LLM, let that do all the grind work for you so you can be a better practitioner in your role. I just love that. I think for me that's almost the perfect summary of of what we've spoken about today. And there are positives, but there are also guidelines. And I'm not going to say dangers. I'm going to say guidelines parameters within which to work.
Right.
So, any final thoughts, Dimitri, before we close off for today?
No, I think it was quite positive. Let's keep it positive note. After all, because it was all dark beginning, issues, problems. So I think we that's a good end.
That's a good end. So let me just finish off then. Thank you very much, everyone, for joining us today. Again, we at Glorium Technologies, we would love to have a conversation with you. We have a really good 90-minute presentation that we can come and do within your leadership team, within your offices, either online or on site. We would love to come and share how you can use AI technology, the generative and predictive AI, in your organization. And the easiest way to get involved is to understand and get a better knowledge about how it can actually help you in your day-to-day activities. So we have this 90-minute presentation we can come and do. It's not a sales pitch. It is really just a way to expose you to this wonderful world. But what we'll do in that 90 minutes, make it more specific to your environment and your use case. In other words, the actual issues you might want to solve, and we can come and do that online. So you're welcome to schedule an appointment for that. Have a look at our website. Have a look at some of the information we've been putting out there. And please, let's talk. Let's have that conversation, and let's see if we can get some of the positive aspects and understand some of the negative aspects and how we can advance this to your benefit. Looking forward to having a conversation next week again, Dimitri, and all the best. Goodbye.
It was good talk. Bye, Dudley.